Good afternoon. I'm Dr. Ashwin Vasan, New York City's Health Commissioner, and it's an honor to welcome you to our Summer 2022 Reimagining Public Health Series. Once again, the series has drawn together New York City Health Department staff with our partners in government across the state, organizations outside of government, and people committed to thinking about public health and health equity in new and transformative ways. Previous series events have focused on building narrative power for health equity and racial justice, collective recovery and wellness during COVID-19, indigenous knowledge and values for health equity and justice, and more, all serving to bring together a diverse group of stakeholders and to develop new perspectives on how public health can become far more fair, equitable, and anti-racist. I'm sure today's topic, highlighting reparations and the racial wealth gap, will spur conversation, tough questions, and I hope new ideas on addressing the critical but underexplored connections between health and wealth, and the terrible disparities that persist, especially between Black and white Americans. Today's speakers, Dr. William A. Darity Jr., Stephanie Dinkins, and New York State Health Commissioner Dr. Mary Bassett, bring a wide breadth of knowledge, expertise, and insights to this conversation, and I'm so grateful to them for making the time to join us today in conversation. I'm also deeply grateful to our Chief Medical Officer and Deputy Commissioner for the Center for Health Equity and Community Wellness, Dr. Michelle Morse, for elevating this topic throughout her career and for moderating today's conversation. I wish you all an engaging and productive discussion today, and thank you.
My name is Dr. Julian Watkins. I'll be doing today's grounding. I thought it appropriate to call in the work of Audre Lorde, a New York City native who was self-described as a Black, lesbian, mother, warrior poet. Lorde dedicated both her life and her creative powers to confronting and addressing the injustices of racism, classism, white supremacy, imperialism, sexism, and homophobia. I'll be reading A Litany for Survival, which is a poem that was first published in Lorde's 1978 collection, The Black Unicorn. A Litany for Survival. For those of us who live at the shoreline, standing upon the constant edges of decision, crucial and alone, for those of us who cannot indulge the passing dreams of choice, who love in doorways coming and going, in the hours between dawns, looking inward and outward at once, before and after, seeking a now that can breed futures like bread in our children's mouths, so their dreams will not reflect the death of ours. For those of us who were imprinted with fear, like a faint line in the center of our foreheads, learning to be afraid with our mother's milk, for by this weapon, the illusion of some safety to be found, the heavy-footed hoped to silence us. For all of us, this instant and this triumph, we were never meant to survive. And when the sun rises, we are afraid it might not remain. When the sun sets, we are afraid it might not rise in the morning. When our stomachs are full, we are afraid of indigestion. When our stomachs are empty, we are afraid we may never eat again. When we are loved, we are afraid love will vanish. When we are alone, we are afraid love will never return. And when we speak, we are afraid our words will not be heard nor welcomed. But when we are silent, we are still afraid. So it is better to speak, remembering we were never meant to survive. Thank you.
Thank you so much, Dr. Watkins, for that offering. And thank you so much, Commissioner Vasan, for opening up this event. My name is Michelle Morse. I'm the Chief Medical Officer and Deputy Commissioner for the Center for Health Equity and Community Wellness at the New York City Health Department. It is an honor to welcome you to our fourth event in the series, Reimagining Public Health for New York City. Today, of course, we are honoring Juneteenth, And we are going to be having an incredible conversation with people who I look to answer all the biggest challenges in the world. And so we're so honored to have these esteemed panelists with us, again, to honor Juneteenth and to really explore in depth what the racial wealth gap is about and what reparations offer this country as an intervention for both justice and policy change, amongst many other things. So I'm really honored to share a few opening remarks, and so also honored again to be here with all of you as co-panelists who I will be introducing in just a moment. So I can't say enough how important this conversation is, particularly to see public health engaging in this particular conversation. And as all of you know, public health is in an incredibly challenging moment as a discipline and as a priority. And yet all that we're seeing day after day is how the COVID pandemic persists, unfortunately continues to evolve. And we have new challenges like monkeypox, as well as ongoing mass violence and mass shootings. But I think it's also important for us to honor the fact that we actually have a lot of tools in our toolkit for advancing public health despite these challenges. And no matter what we have to understand is that planning, policy change, and understanding how systems of oppression like systemic racism hold us back but are not permanent. They are human-made. And these are human-made challenges that we can change. As we also know, the causes of health inequities are locked in a deep, harmful feedback loop with wealth. And ongoing discrimination, of course, prevents communities of color in particular from accessing the wealth and assets that they deserve to both address their needs as well as to improve their health. And so it's within this awareness that we have to have a conversation about the racial wealth gap and reparations. And we have to make sure that that conversation, of course, is crossing many disciplines. Myself as a physician, of course, reparations and the racial wealth gap was not a part of my medical school curriculum. And yet this is an area that we all need to make sure that we're able to speak about, to learn about, to talk about openly. So with that, I'm honored, of course, to introduce very briefly my co-panelists, the panelists for the conversation today. I'm honored to be joined by our New York State Health Commissioner, Dr. Mary Bassett, who is a former commissioner for the New York City Health Department as well. Thank you for being with us, Dr. Bassett. I'm also, of course, honored to have Stephanie Dinkins, who is a transmedia artist and Kusama Endowed Professor in Art at Stony Brook University. Welcome, Professor Dinkins. We're honored to have you with us. And then last but certainly not least, we have Dr. William Darity Jr. joining us from North Carolina. He's the Samuel Du Bois Cook Distinguished Professor of Public Policy at Duke University. So again, just a virtual round of applause for this incredible panel. Thank you all for making the time. We're so thankful that you're here with us. So I'm just going to have us jump right on in. I think, Commissioner Vassen and Dr. Watkins warmed up the space for us. And here we are having this conversation. I also want to highlight that folks are able to submit questions. If they have questions, we'll be collating the questions all along the way during the conversation today. And we are going to be asking the panelists some of the questions that you all are submitting as a part of this conversation. Even though we're virtual and not in person, we do want this to be a bi-directional dialogue with all of you who are tuned in right now. So thank you for being with us. We are tracking your input, your questions, your guidance. So with that, I actually want to turn to Professor Darity for the first question. And this first round of questions are really going to be about some of the foundational concepts that help us understand the racial wealth gap and its connection to health. So with that, Professor Darity, you recently published a book called From Here to Inequality, and you talk a lot about the counter narrative to what many of us are taught in school. We're often taught that enslaved people were emancipated and they finally had access to the same opportunities as everyone else, including, the same opportunities as everyone else to generate income. And that, of course, is absolutely false. So I'm wondering if you could start the conversation today by telling us a little bit about the groundwork on how policies from slavery until now have systematically led to less wealth for Black Americans. And if you can also tell us a little bit about the racial wealth gap, we would be honored to hear from you.
Thank you. And thank you in particular for your personal dedication to the cause of creating a more equitable society in our country. The book title actually is From Here to Equality. We don't want to get to inequality, I don't think, and we got plenty of that. But one of the central ideas in the book is that there is a case for reparative justice for Black Americans that's predicated on not slavery alone, not even primarily slavery, but on the circumstances that took place after slavery ended, the conditions that actually produced and created the existing racial wealth gap, which in our book, From Here to Equality, Kirsten Mullen and I argue, is the best single economic indicator of the cumulative intergenerational effects of white racism. And so we focus in large measure on a set of policies that the federal government pursued in the aftermath of slavery that has been foundational to creating the racial wealth gap. The first of these policies is actually a failure to meet a commitment and promise that was made to the formerly enslaved to provide them with 40-acre land grants as restitution for their years of bondage. This was a commitment that was made. There was an initial effort to try to activate this program through General Special Field Orders number 15. That was an effort blocked by Lincoln's successor, President Andrew Johnson, who attempted in a very systematic way to reverse all efforts that were being made to provide the formerly enslaved with the conditions for full citizenship. So there was no land given to the formerly enslaved, but simultaneously there were 160 acres of land given to individual white families under the Homestead Act of 1862. In fact, it's estimated that 1.5 million white families, including those who had recently immigrated to the United States from Europe, received these land patents in the Western Territories as the nation completed its colonial settler project. The social scientist Trina Shanks Williams estimates that there are 45 million living white Americans who were beneficiaries of the Homestead Act land patents. So that's the first set of policies that are associated with the period where the federal government was engaged in asset building through land distribution. Land goes to white Americans, land does not go to the Black Americans who had been subjected to slavery. The second set of policies involve the sanctioning and support for 100 massacres that took place from the end of the Civil War into World War II. Some of them are notable instances for the public imagination. Would include the Tulsa Massacre of 1921, which I think people are familiar with because last year was the 100th anniversary of the atrocity. But there were many, many more of these that took place, including Wilmington, North Carolina in 1898, as well as Colfax and Coushatta, Louisiana, immediately after the Civil War. And in the year 1919 alone, there were 35 of these massacres that took place, resulting in that period being referred to as the Red Summer. And these included massacres that took place in Chicago, Illinois, Bisbee, Arizona, Wilmington, Delaware, and Elaine, Arkansas. Then one of the consequences of these massacres was not just massive loss of Black lives, but also the appropriation and seizure of Black-owned property by the white terrorists, again, contributing to the racial wealth differential. In the 20th century, the federal government shifts away from asset building by land distribution to asset building by providing people with supports for home ownership. But unfortunately, this policy was conducted in a discriminatory fashion, ranging from the practice of redlining, which led to credit starvation for black neighborhoods, black communities, as well as limiting access to home ownership opportunities for Black Americans, as well as the introduction of the GI Bill in the aftermath of World War II as a support system for returning veterans that was discriminatorily applied as well, so that white veterans had a tremendous opportunity to move into the middle class, in part through having access to home ownership for the first time, while Black veterans were denied comparable opportunities. The final set of policies I'd like to mention at this point involve the federal highway system, which is introduced in the 1950s and 1960s on an extensive basis. And consistently across many, many cities in the United States, the selected sites for the freeways that were funded through federal monies were Black neighborhoods, Black communities. And the freeways frequently were run directly through Black business districts, again, damaging the wealth position of Black Americans and contributing to the maintenance of the racial wealth gap. So how large is the racial wealth gap in the present moment? Well, if we look at the data from the Federal Reserve Bank's Survey of Consumer Finances, we find that the average Black household has about $840,000 less in wealth than the average white household. This corresponds roughly to a condition where, on a per person basis, the gap is $350,000. If we were to eliminate that differential through an expenditure project that would close the gap, it would require at least $14 trillion. And so in the work that Kirsten and I have done, we've argued that the minimum size of a reparations bill must be sufficient to eliminate the racial wealth gap, and hence it should be at least $14 trillion.
Thank you for that, Professor Darity. I mean, I don't know how you did it so succinctly, but 200 plus years just of recent history. Thank you for describing that so clearly. And in particular, I just want to underline, we often are looking at the impact of structural racism, enslavement, et cetera, on Black people today. We don't often enough, I think, shine a light on white advantage, white privilege, and all the policies that have led to white wealth accumulation. And I just really appreciate you in particular talking about the Settler Colonial Project and the Homestead Act and the 1.5 million white families that benefited from that. Because again, I think we often look at the flip side and need to continue to make sure we understand the other.
Did Dr. Morse freeze?
I think she did. Oh dear. I mean, this is a wonderful thing, except when it isn't, this virtual.
Looks like she's trying to come back in, I guess.
Yeah. Very good. Thanks. It's wonderful.
Someone didn't want me to say that. I don't know what happened. Sorry about that. I apologize. Okay, I'm back. Well, anyways, thank you. Thank you again for kicking us off so clearly, Professor Darity. Very much appreciated. I want to turn to Dr. Bassett next, actually. And Dr. Bassett, again, you have dedicated so much of your career also to describing how history shapes health outcomes. And for the conversation today, of course, we're talking about the relationship between the racial wealth gap and public health as well. And so I'm wondering if you can talk a little bit about how you see the connection between the racial wealth gap, wealth in general and health and wealth as well. If you could speak a little bit about that as a public health leader.
Sure. And I just want to say what a pleasure it is to join this panel. And it's wonderful to hear Professor Darity with Kirsten Mullins. They really have given us all the gift of a very carefully thought through case for the importance of eliminating the racial wealth gap if we are to overcome the legacy of enslavement in this country and all that followed, as you've just outlined. So I just wanted to make a couple of comments, and I don't think that I can speak as eloquently as Professor Darity has, but just to remark on the whole question of land. I've promised myself that I won't talk about the impact of enslavement without talking about the impact of genocidal strategies with respect to indigenous people in the United States. So those land grants, those 160 acres, those were all extracted from the Western nations. And they were, this was, as Reverend Barber calls it, these stolen lands worked by stolen hands. And certainly it's a source of shame to me that I didn't realize the terrible health statistics, that people, the descendants of the people displaced by European colonial settlers, and I agree that that's the right way to frame it, that is written on their bodies to this day. So I'm a medical doctor and somebody who works in public health, and there's a key fact that stands out for all of us who look at racial disparities in health, particularly Black-white disparities, which are the most studied in the United States. And that is that there has not been a single year since vital statistics were collected that we haven't seen higher rates of illness and higher rates of death with shorter life expectancies in the population of African descent. This has been an enduring fact, so enduring that some people have come to see it as natural, either because of some kind of genetic proclivity to sickness and short lives, or related to some kind of cultural deformity related to, depending on how you frame it, either oppression or, but in any case, the blame lies with the people. This gap is, we know, related to income. And the data on income and health are very robust. But very often, we haven't been able to explain the whole of the racial gap. In fact, in most cases, we can't, by accounting for income. So that's why it's really important that we talk about racism and health, and not just about poverty and health, even though poverty explains a great deal of the health disadvantage of the population of African descent in the United States. It doesn't explain all of it. That doesn't mean that it's not explainable. And I would say that the argument should be that the rest of it is accounted for by racism, which has affected all people, regardless of income, in the United States. But it may be that a bigger chunk of this gap is related to the wealth gap. We just have not had adequate data to study that. But in some of the studies that have imagined what would happen if we could eliminate the wealth gap, it shows that we could virtually make indistinguishable outcomes between Blacks and whites in the United States. So I guess Professor Darity will correct me if I don't put this as succinctly as he would, but income is sort of like, what flows in. It's your turnover of financial resources, whereas wealth is more like your reserve. It's your ability to deal with shocks. It's sort of almost the foundation of economic well-being. And that has been not available to people of African descent. So, having looked at the historical record and looked at my own working life in public health, which now extends to like 40 years, it's my firm belief that we have to address the racial wealth gap if we are going to succeed in eliminating the racial health gap. And, you know, that's what brought me to the idea that people in public health should get interested in the Reparations Project. So it's interesting to me that Professor Darity didn't talk about redlining, which I often use as an example of structural racism. Did you talk about it? If you did, you talked about the highways. It was sort of related to
mention redlining in the GI
highways.
Bill. Yeah.
Yeah. Oh, you did. Okay. Well, this is something, and you know, that I think about that that maybe economists don't, and we've talked about this before because I've had the privilege of interacting with Professor Darity before. Is not only were individuals deprived of wealth, intergenerational wealth, but communities were deprived of assets. Things that belong to communities that we don't really consider personal assets: parks, sidewalks, transport, clean air, tree cover. All of these were also deprived because of structural racism in this country. So one of my concerns about just looking at the individual or household level wealth gap, although this would be a great place to start, and $14 trillion is a big number, is that we also have good data to show that our hospitals aren't as well equipped, that our neighborhoods don't have as many trees, that they, you know, there are problems in public safety, housing quality, employment opportunities. All of these are not necessarily attributes of individuals, but they also demand, in my point of view, restoration. So I worry that just by talking about household or individual wealth, that we lose some of the picture of place-based deprivation, which is so important to public health thinking. So I should just stop there, I think, although I hope that we can get to talking about what's going on in California, which has has put out an interim report, 500 pages worth of it. So I have to confess I have not read it, but they have a section on health in there. And I know, Professor Darity, you've had something to do with that effort, and it would be great to hear something about it as well.
Thank you so much, Dr. Bassett. Never give that disclaimer about being eloquent or precise. You really described it so clearly. So thank you for doing that. And also thank you for your courage. Some of us who are in the medicine public health.
I didn't do my disclaimer, but I'm, you know, obviously, this is not an official policy of the governor of New York State. Although I do want to say that you know, that the governor did sign into law a whole raft of laws joining many other over 200 jurisdictions in describing racism as a public health crisis.
Absolutely. Absolutely. Thank you for that. And also thank you for bringing the conversation about reparations and the racial wealth gap to mainstream medical journals as well. Your piece in the New England Journal a few years ago was really groundbreaking. Many of us who've been in medicine and public health for a while never thought we would see an article or a perspective.
You know, I was getting ready to get a compliment. But I do want to say that the opening of the pages of top-tier medical journals to conversations about structural racism is because of the murder of people, and you know, because of Ferguson, because of the murder of George Floyd. I have to say that that our field responds to external events. I don't think it's because we became smarter or something. The conditions around us demanded that public health, that medical journals start engaging with this topic. And since we're waiting for Michelle to come back to introduce the next person, the other thing to point out is that the U.S. as a nation is doing terribly in terms of health. We have had the most deaths by far due to COVID of other wealthy nations. And our mortality rates are higher, resulting in, hundreds of thousands, if not a million missing Americans because we haven't succeeded in delivering the same life expectancy to our population as other wealthy countries. And of course, most of those missing Americans are people who are classified as white. So, keeping in mind the burden that the entire country carries because of its origin story, frankly. Professor Darity, should we move on? What should we do?
Well, I guess we should ask Ms. Dinkins to go ahead, I guess, if
Okay.
you don't mind.
If you don't mind.
No, I think you're on mute.
I don't even know how to mute myself clearly. I'm on my phone.
Yeah, she's on mute.
She is. If I knew how to mute myself, I would.
Can't hear her.
We can't hear her.
Yeah.
Well, do you want to respond to anything I've said, Professor Darity? We can't. Dr. Dinkins, I apologize. We cannot hear you.
Can't hear. Yeah. Okay, Michelle Morse is coming back in, I believe. Okay. Yeah.
Sorry about that. Hopefully you guys can hear me okay.
We can hear you, but we couldn't hear we couldn't hear Sandra Dinkins.
Let's see. Stephanie, it might work if you
Stephanie. Sorry, Stephanie, I can't hear your name. There we are.
You might have to refresh the browser, Stephanie, sometime. I don't know if that'll do it. Sometimes
I just
that
did.
helps. Oh, there you go.
Oh, good.
Can y'all hear me?
We can.
Okay, excellent. Should I just jump in again? Is that the way we'll do this? Okay. So I was just saying, everyone, hi, Stephanie Dinkins. I'm not often referred to as professor, so that's weird. I'm the artist in the bunch, but I'd like to say, and I also consider myself a citizen, right? Which I think is really important in conversations like these. I come to the idea of reparations from someone who is trying to imagine in the world I really want to inhabit. One of my mentors has said, artists are change makers and emissaries, uniquely positioned to help the general public, corporations, and government entities understand why deeply rooted topics, such as reparations, are relevant to our day-to-day lives, right? And I truly believe that and work towards it, right? And so my work has been recently around the technological future, artificial intelligence, surveillance, reparations, all the things that we have, and that might come forward to help us build a better, more equitable, fair, and caring society, right? Those are the things that I'm truly concerned with and trying to get thought going on the basis of other citizens like me, and to the folks who are working in government, like the folks on this call, and academia, right? And so I want to know, what can we imagine and how can we think beyond the things that we are told that are not possible, right? And in my practice, especially in artificial intelligence, I'm often told, oh, sorry, what you're trying to do is not possible. Okay, fine. And then I go about my business, do my work, and make something where it shows that it is possible. It's just not the goal of the entities who are working at a higher level. But once they see that, they have a model that's hard to ignore. And so my idea is, in terms of thinking about what's gone through the past and what comes into the future, how can we each take on some idea that we want to see in the future? Start to enact it, right? Regardless. And I'm not saying there are not barriers. I'm not saying that there's not systemic problems that get in our way. But what I am saying is that, you know, especially as Black Americans, I think we come from a tradition of making a way, right? And trying to forge something. And right now, that forging is how do we get and how do we close the wealth gap? And I really think that's important. I, being the beneficiary of, you know, grants and fellowships that have allowed me to close that, and what it's made possible, right? Like what it's made possible in my life, and what I believe it could make possible in many people's lives. Um, Without, and I'm going to say in particular, without stipulation as to what people should be doing with that money, right? I think it bodes well to move society in general, not just for Black folks, forward, right? And into more caring territory. And so that's really what my work is about, trying to find those paths, trying to create the stories and the myths that we tell ourselves over and over, make them broader, make them more open, make things seem much more possible, and then actually modeling it, right? To say, well, here's this tiny model, but it is a possibility. So that's my modus operandi, and how I got here. Thank you.
Incredible. Incredible. Thank you so much, Stephanie. And I have to, of course, say that we had the honor of getting to be fellows together in the Soros Equality Fellowship. And that's where I first learned about Stephanie's work several years ago. And again, I just have to emphasize, to have a state health commissioner, an economist, an artist speaking about this issue, it just gets at the richness of both the challenge and the opportunity. And I, in particular, appreciate what you said, Stephanie, about making, you know, what people say is impossible possible, right? I mean, you know, there's so many examples of us being told it's not possible. And I just am so thankful for the work of artists like yourselves who help us to remember that it's with creativity, with solidarity, with vision, and with dreaming, and remembering that we can make the impossible possible, and we've done it before. So thank you in particular for that. In this next round of questions that I'm going to ask you all, I would love to get a little bit more into some of the paths forward, actually. And there's so much richness to our conversation already. So I know that you all are going to, you know, give us all kinds of incredible ideas on the paths forward. But just before I get into that round of questions, I also just want to take a moment to think a little bit about the trajectory. And the reason I want to do that is because, as many of you know, of course, in the audience, there's been a lot of conversation recently about critical race theory in the news, a lot of misinformation about what critical race theory is, a lot of confusion, I would say, about what it is, and in fact, a lot of really incredible things that we can learn from the theory to help us move forward. But one of the things that I think is, a helpful visual representation of how helpful critical race theory is for us in understanding, you know, what the trajectory of racial inequities has been in this country is just a graph, a series of graphs from an op-ed that Keeanga-Yamahtta Taylor published in the New York Times in June of 2020. And I hope that you all are able to see this okay for those of you tuning in. And for those of you who are panelists, I'm not sure you're going to be able to see it too well, but essentially what it shows is the trajectory of differences between Blacks and whites in this country from the 1960s up until the 2010 era. And every single graph shows a persistent gap between Black and white. At the top left, it's unemployment. Then we see the share of people who have completed 4 years of college. Then we see median household income. Then we see home ownership rates. We see incarceration rates. We see life expectancy. And, you know, I should highlight that the life expectancy at birth graph in the bottom right essentially is going to be diverging, right? Because everything we know from the COVID pandemic has shown us actually that Black people have lost life expectancy significantly more than whites. And so even this bottom right graph is already outdated because that life expectancy gap is even worse now since the COVID pandemic started. Again, the gap between Black and white. And so in all of these trends, since the era of the civil rights movement, we see that this gap between Black and white has persisted. In some ways, this represents white supremacy in our country, right? I mean, this is in some ways a visual representation of it. In other ways, I think it is a compelling piece for conversation for this panel in particular, because what we heard from Professor Darity, of course, is about some of the origins of the gap between Black and white in this country for wealth, but also, of course, it impacts everything else. And so I just wonder if we could take a minute for anyone on the panel, no pressure, whoever wants to say something, feel free to jump in. If not everyone needs to speak about this. This is kind of an impromptu provocation. But I do wonder if there's anything you all might say about, what the trajectory has been of the racial wealth gap as well, and other Black-white gaps in this country over time. And, anyone feel free to jump in with any reflections you have on that persistence of that gap.
I really can only speak to the racial health gap, so I'll pass on that one. But as everyone knows, COVID has been extremely damaging and reversed what had been a substantial narrowing of the racial life expectancy gap, which has now re-widened. White Americans lost less than a year of life expectancy. Black Americans and Latinx individuals more like 3 years. But I don't really know what's happened to wealth. I can't imagine that they didn't go in sync.
We won't have data on wealth post-pandemic until the new survey of consumer finances is completed. And this is a survey year, 2022, but they don't usually release the results until September of the following year. So we won't actually see the 2022 data until September 2023. But that will be the first post-pandemic survey of any substance that we have where we could look at wealth differentials. But there are good reasons to speculate that the wealth gap has widened. In the first month after, we sort of agreed as a nation that we were in the midst of the pandemic. In April 2020, about 40% of Black-owned businesses went out of operation. And so that has to have some ramifications for the Black wealth position. And so I would speculate that we will probably see a wider gap in the 2022 data, although I'm not certain about that. I'd like to reemphasize a point that Dr. Bassett made when she was talking about the distinction between income and wealth. And I thought that was a great intuitive explanation of the difference, so thank you. But what I want to say is that frequently people make the argument that when you examine income as an indicator of social class, if you look at Blacks and whites who are in a similar income position, that, they argue, frequently erases these kinds of differences. But there's absolutely no evidence to support that for virtually any indicator that we could consider. And one of the most glaring is if we look at infant mortality, where the women with the highest infant mortality rates are Black women who are the most highly educated. Black women with professional degrees and with doctorates have the highest infant mortality rates across all women. And so if we try to control for social class by using income, we're still going to see tremendous disparities. I'm not sure to what extent those disparities are necessarily eliminated in full when you eliminate the racial wealth gap. But Dr. Bassett did refer to at least one study that I guess the three of us here have been involved in. And the person who led the study was Eugene Richardson. And it's a study that tries to simulate what the effects would be of eliminating the racial wealth gap on the spread of the pandemic. And I think that the argument is that if we had had no racial wealth differential, the transmission rates for COVID-19 would have been anywhere from 31 to 68% lower than the rates that we actually experienced. And so I think that's a very, very powerful finding, and is indicative of the importance of focusing on wealth in addition to income.
Yeah. Can I just say something, because something comes in on imagination here, and I want to involve our artists, who I made a professor and a doctor, because we've had a lot of trouble publishing this work. And part of the reason has been that we're doing a thought experiment, trying to imagine that we could eliminate the wealth gap. And, I just want to, there are a couple of papers floating around, and I just would point out that it's been really difficult to convince editors that they should publish this stuff, because they just don't think that the data are good enough, even though what we're asking people to do is imagine. I mean, of course we can't show this in the real world. We're asking them to imagine what it would be like. So I thought, Stephanie, that this reminded me of some of the things that you said. Maybe artists can help us with this, because what we have is a failure of imagination, not just a failure of data.
Yeah, I would agree. I think we often have a failure of imagination, and artists are perfectly placed. We are given a lot of leeway that other people aren't. And so we're not asked to prove things a lot of times. We put things out into the world and they can float. But they also can gain traction, right? And it's in that traction that things get pretty interesting. My own career is a very good example of that. Like, I'm talking about things I don't really know about in a kind of academic, deeply learned way, but I've learned a lot through the processes and then put ideas in the world. And the world who is making is paying a lot of attention, which surprises me, right? Because you would think there's not that sense of power. But if there's a way to collaborate so that, you have the help of people who are making to make new stories around it, not just the scary stories or the most dismal stories, but the ones that kind of show, well, this is something that might be. And an example would be, I'm thinking about reparations right now in line with blockchain. And what happened if we made a chain that kind of showed what happens if reparations were given? Because we can intervene and do that. Right? And I get to just dive in and do it and then say, here are the results, look, versus having to kind of go and have the proof and then flip it back and then go back into the journals, which I think is the interesting thing. I believe in a pull strategy in terms of marketing. So, you make it and then you get them to want you, because a lot of times otherwise they try to chop you off before you even get started.
Thank you for that, Stephanie. Yes, absolutely. And thank you for encouraging us, of course, to continue to engage with you. And thanks, Dr. Bassett, of course, for pulling Stephanie in this way. I think it's so important, right, that our practice of hope be, very, very well nourished in times like this and in general. So thank you for sharing that. I want to give a quick shout out to everyone who is watching right now, to the audience, to everyone online. We're seeing your questions roll in and your comments roll in as well. In fact, so we are going to get to your questions in just a little bit, but before we do, I want to just mention a comment that came in from someone who is watching right now. And again, thanks to everyone who tuned in. This person's comment says, I hope to have a deeper dive into reparations in the future to see it in more detail. I think we're all thinking that. And I do want to just ask one more round of questions, and I want to turn to Professor Darity on that point specifically because of your scholarship on reparations. And I'm wondering, Professor Darity, if you could just speak a little bit more to what reparations are based on how you've defined it, who should get reparations, who's eligible. Can you describe a little bit of your work for us on reparations specifically?
Yeah, so in the work that I've done, reparations has been defined as a program of acknowledgement, redress, and closure for a grievous injustice. Acknowledgement, redress, and closure. And conveniently, that falls under the acronym ARC or ARC. An acknowledgement means that the culpable party, the party that is responsible for the harms, acknowledges or admits that they bear responsibility for those harms, and also makes a commitment to undertake some form of restitution for having committed those atrocities or damages. The acknowledgement can be viewed as an apology, but it must be an apology that is accompanied by a commitment to undertake some form of compensation on behalf of the victimized community. The second component, redress, is the act of providing compensation. And historically, when we think about victimized communities as a collective, the way in which compensation has been conducted is by the provision of monetary payments. Whether we're talking about the German government's form of reparations that it provided to the individuals who were victims of the Holocaust, or if we're talking about the United States government's procedure for providing compensation to the individuals who were Japanese Americans who were subjected to mass incarceration during World War II. Both of those cases, monetary payments were made. And so I think that's a critical dimension of this. Yes, there's a host of other conditions that need to be improved or changed. I think Dr. Bassett was talking about community level conditions that need to be addressed. I'm not certain to what extent, if we close the racial wealth gap, it would give the Black American population the political capacity to ensure that neighborhood conditions were improved, but we can also make a case that that should be a separate activity that needs to be conducted. And then the third and final component of the reparations definition that we use is closure, which is an agreement on the part of the culpable party and the victimized community that the account is settled, that the compensation that has been provided is adequate for the purposes of saying that there will be no further demands made upon the culpable party unless there is a renewal of the atrocities or new atrocities take place. You also asked me about, in the context of thinking about Black reparations in the United States, the question about eligibility. And so in the work that I've done, and this work dates at least to 2003, I always worked on the assumption that when we were talking about reparations in the United States for the Black community, we were talking specifically about the segment of the Black American population that had ancestors who were enslaved in this country. And that was an assumption I made from the very beginning of some of the work that I was doing on this topic, and was a bit surprised more recently to discover that that's a somewhat controversial position. And I think that the controversy arises because, particularly since the 1960s, there has been a substantial increase in the presence of Black Americans in the United States, whose families have immigrated to this country more recently. So why should the focus be on Black Americans whose ancestors were enslaved here? I think that the fundamental reason is because the debt that is owed arises from the failure to provide this community's ancestors with the 40-acre land grants that they were promised in the aftermath of the Civil War. That's the foundation for the debt. That's the community to whom the debt is owed. Now, I absolutely think that Black people across the diaspora have reparations claims, but they don't all have reparations claims that should be directed at the United States government. So, for example, Haitians have a powerful claim on France. And that's an especially powerful claim because France actually made Haiti pay reparations to France in compensation for Haiti's own liberation from slavery and colonialism. And so that money should go back to Haiti with interest as well as other resources from France. Or the Congo has an obvious claim on Belgium. The countries of the Caribbean that form CARICOM have a claim that they are undertaking in the present moment against primarily against the United Kingdom. So everybody, I think, more or less has a claim. The question is, who is the claim to be directed against? And in the case of the United States, I think that the claim is one that has to be directed against the U.S. government by the individuals whose ancestors were enslaved in this country.
Thank you again for your work publishing in many, many different fora, including the book around that framing and that definition. It's one that I think has been an inspiration to many of us, again, because it's so clear, and the ARC acronym, of course, kind of resonates. So thank you for describing that also so clearly. And we're gonna there's a couple more questions that have come in. Again, I'm gonna get to those in just a second, but I'm gonna take my moderator's privilege and ask Dr. Bassett and Stephanie one more question, then we're gonna turn to yours. So I'd like to direct the next question to Dr. Bassett, and again, follows up on this kind of round of questions around reparations. We have seen in the COVID pandemic in particular, how inequities, of course, that for some people were invisible have become more visible, right? We've all heard that refrain about 1 million times in the past 2.5 years. And yet this is a moment where the inequities that have impacted health outcomes in particular for communities of color, Black, Indigenous, and people of color in particular across this nation is clearer than ever. And COVID, of course, has made part of that possible. But you, Dr. Bassett, have studied this for, as you said, 40 years. So I'm wondering if you can talk a little bit about how you see, what does justice look like in healthcare in the COVID-19 era? Can you tell us how you're thinking about it?
Okay, let me see if I can break that down. So the problem with COVID, at least at the outset, I believe, was related to the problem of exposure. Who was getting, this was before we had vaccines and treatments, before we really knew preventative steps that could be taken. We can answer the question of who was an essential worker, who had to go to work because they couldn't afford not to go to work, who was going home to crowded households on crowded transport. And additionally, then, in addition to that, which answers the question, what was your risk of getting infected, were the differences in the likelihood of having severe disease. And we know also that many of the things that we now call, comorbidities are tracked with race ethnicity. So we have higher rates of high blood pressure, diabetes, obesity, higher rates of asthma, and the fact that these conditions occur more commonly is also a consequence of the way in which our societies are structured. and shouldn't be considered purely a problem of personal behavior. So I think, to me, that's the most important lesson from COVID, that these differences in outcomes were structural in origin, that they appeared rapidly. We saw huge racial disparities in mortality in March of 2020, when the first case was described in the United States in January. So that's the lens that I've brought to my work from when I, first started out thinking about these issues in the 1980s. That the origins are not related to, bad choices or bad genes, or even bad opportunities. That's we aren't after equity and opportunity. When we have that in real life, we will have equity in outcomes. And so that's my litmus test. The litmus test for when this country has finally overcome the legacy of enslavement is when we no longer see these group partitioning of health outcomes. There's no reason that a person who's classified as Black should have less have systematically lower chances of living a long and healthy life. Those group differentials are structural in origin, and they reflect the enduring impact of structural racism. So that's what I use as a litmus test. And as I pointed out at the beginning, we haven't got there, and COVID has thrown us back. And COVID has thrown back this country more than other countries that are also capitalist countries, wealthy countries. And so I think we need to start talking about what's going on here. We don't have universal access to health care. We don't have good labor protections. We don't have, the guarantees of a decent life for many people who work hard every day. And that is, because of the overarching impact of the pursuit of profit.
So crystal clear. So crystal clear. Thank you so much, Dr. Bassett, as always, for bringing such clarity to one of the most complex issues, of course, that we're all dealing with. Thank you for that. So clear. And it's kind of actually the perfect segue for me to ask this question to Stephanie. And then again, I'm going to get to the audience questions. So panelists, get ready. There's some very interesting questions that have come in. So get ready. But so just before we go to those, Stephanie, you have also spoken about Afro-now-ism as an approach, as a framing, as something that kind of carries us forward, brings in that creativity and that sense of possibilities. I'm wondering if you could just speak a little bit about that and how it may be helpful in our conversations about ending the racial wealth gap, moving forward with reparations, advancing health justice, all of the things that we've been talking about in this conversation.
Sure, Michelle. First, I want to say I so agree with Dr. Bassett, and in terms of the arts, it's the myths that we continue to tell ourselves, and actually the lies that we continue to tell ourselves, right? That we are the most powerful, most wealthy, most medically well country in the world, and it's just not true. And I think we need to really start telling ourselves the story that is true so we can start to rectify. But in talking about Afro-now-ism, it's sort of my take on an Afro-nowist looking into a future, right? But it's about a willful practice that imagines the world as it needs to be, right? As you need it to be, to support successful engagement and what I've really come to think of as care throughout systems, right? I like to think systemically in how we kind of intervene in systems and get those systems to be constructed with care and support of community in mind versus surveillance and this kind of segmentation of community, right? Thinking a lot about taking the leap and the risks, because there are definite risks involved with like being the one who sticks out the head to say, this is what has to happen, and we're going to do it and try it. And then we're going to submit it to a journal or try to get it published otherwise, right? Like, how do we do that? it's about pushing through those things so that we can actually have conversations that seem to matter and speak to a reality versus conversations that speak to the myth of who we are and misinform us. So I'm always thinking about what it is we can do, whether that be as individuals, whether that be as local communities, whether that be as governments, to challenge the spaces that are entrenched, right? And if necessary, to model the things that are necessary, right? And you'll notice I keep coming back to this idea of modeling, because in a way for me, it's about, if we wait for these things to happen on a grand level, we will be waiting a long time. And so, thinking about, well, how do I lessen the wealth gap in a sphere of influence that I have? Right. And that's a true question for me in particular. And like imagining that rolling out, right? Like if we're working towards those things individually and towards our governments, but trying to enact things, trying to take action and using imagination to do those things. That is where Afro-now-ism is for me.
Thank you for that. I love it. I mean, again, what a beautiful call to action and a beautiful way for all.
Could I inject a comment here?
Go right ahead.
Mm-hmm.
Well, I wanted to say that that the term imagination has a particular resonance for me. And I'm really grateful that you introduced it into our conversation today. A couple of days ago, I was giving a talk about another policy that I've been a longtime advocate of, which is a federal job guarantee. And whenever I start talking about the federal job guarantee, people always ask, well, what kinds of jobs are people going to do? Aren't you just going to give them make work jobs? And my response is that there's all types of work that could be done in this country that would be socially useful that the private sector doesn't provide adequately. And this would include both the physical and the human infrastructure. So the human infrastructure would involve the provision of professional elder and child care. We also could use a federal job guarantee employment force to solarize our communities and the like. And in the old days, under the Works Progress Administration during the Depression, artists were employed to do art. and so the comment that I always close with is to say that the limits of possibilities with respect to work that people could perform are set by our imagination. And so it really clicked for me when you were thinking about what the world could be like if we did different things today to try to make that world that we might want.
Beautifully said. Beautifully said. Thank you. Thank you for that. I want to bring in just a couple of questions from the audience, and then we're gonna have some just closing remarks and a video actually from Professor Dinkins' work actually to also help us continue to imagine and think forward. So I'm gonna bring in a few questions here. We just have time for a couple. So the first one I'm gonna ask is, what are other reparations forms that should be given besides monetary? This is a question, again, from one of you out there. So if any panelists have thoughts on that, I'll just repeat it one more time. What are other reparation forms that should be given besides monetary reparations? This is coming directly from you all who are listening right now.
Okay, I'll jump in. So the form that reparations takes is contingent on what you think the objectives are to be achieved by a reparations plan. If the objective is to eliminate the racial wealth gap, the only way you can do that is through direct monetary payments. There's a number of papers and reports that I've worked on trying to demonstrate that indirect measures like increasing Black education levels or increasing Black home ownership rates won't really actually take us very, very far towards eliminating the racial wealth gap. It's so vast that to paraphrase our Chief Justice, the only way you close the racial wealth gap is by closing the racial wealth gap. Now, if you have other objectives in mind, then there could be other ways of trying to accomplish that that would not involve monetary payments. But if your focus is on the wealth gap, then I think monetary payments of some form are the only way to really do this.
This is not speaking as a person, a medical doctor and somebody in public health, but there was a program by the World Bank. Actually, it was adopted by the World Bank. It was first developed in Mexico and then in Brazil, called conditional cash transfer programs that focused on health outcomes. And what these programs made clear is that the most valuable asset to anyone is always cash. It's the most important way to, and most flexible and portable. I guess that's what I meant, not important. And so, I think it makes complete sense to me that it ought to be in portable currency, not in scholarships or housing loans. But the number's a big one, $14 trillion. That requires a lot of imagination, and I want to echo the call for all of us to stretch our imaginations.
Thank you for that. Absolutely. And thank you for the audience member who asked the question. And again, Professor Darity, Professor Bassett for describing that. Stephanie, sorry, I didn't want to cut you off. Did you want to jump in on that question as well? Okay.
No, Michelle, thank you.
Okay, so one more question from the audience. I think I'll make this our last audience question, and then I'm going to ask the panelists to share a final closing remark, and I'll close this out, and then we'll go to the video. So this question, I think, is a very pragmatic one. This is also possibly one where Professor Darity and Dr. Bassett, you all may want to weigh in. It's a methods question, but Professor Dinkins also, you may have some thoughts on this. So the audience member is saying, how is it possible method-wise to measure the wealth gap in New York City, given that New York City's population is in constant migration? So, again, kind of a methods question about how do we use the numbers to move this work forward? So how is it possible method-wise to measure the wealth gap in New York City, given that New York City's population is in constant migration? Very interesting question.
I don't understand. Yeah. Go ahead, Stephanie, you go first. I don't think any of us are talking about reparations as a project of local governments alone. But in any case, Stephanie, I'll cede.
No, I can agree with that. Although what I would add to that is this idea of asking people, right? I'm involved in a lot of kind of polling projects right now. Like art projects come asking people what they want and what they want to see in the world and how they want it to be enacted. And doing that through methods of algorithmic methods. And I don't know that it would be the be all end all, but I would love to just go to the people and ask them, and we have the capability to do so. So I always default to asking. Although I definitely agree that I don't quite understand. Dr. Darity?
For a number of years, I think for a period of about 3 years, we did a series of surveys at the metropolitan level in 6 different cities in the United States, where we asked people about a series of questions to try to calculate their wealth position. One of those cities was not New York. I've long wanted to try to do that, but these are very expensive surveys, and the constraint was based upon the amount of funds that we could obtain to conduct them. But you certainly could do a survey to get information about what the wealth distribution looks like in New York City, including the racial wealth distribution. Now, if you're concerned about people's mobility. That's an issue with any community that you're trying to survey. But you can always ask people about their length of residency if you think that that's something that is worth paying attention to. And typically we have done that in previous surveys, so there's nothing to prevent us from doing it. But I'd like to echo what both of my fellow panelists have said, is that our conversation has been about a federal reparations program, not something that's conducted at the local or the state level.
Thank you.
And the census actually asks people how long they've been at that address. So we have mobility census. Yeah.
Great. Beautiful, beautiful. Thank you again to everyone listening in for sending those questions in. I know we only got to 2 of your questions, but again, I hope that you'll all be engaging in this series of concepts, frameworks, etc., for a long time to come, and maybe even with your own reading and research based on what was shared by the panelists today, you'll find the answers to the questions we didn't get to ask the panelists. So with that, I do want to ask our incredibly distinguished panelists to share just a closing thought that you'd like for the audience to keep in mind as we go forward, continuing again to reimagine public health. And this is reimagining public health for New York City, but really we are reimagining public health, period. And so with that in mind, would love for each panelist to just share a closing thought or remark that you want the audience to keep at the forefront of their minds as we reimagine together and maybe practice some Afro-now-ism. Professor Darity, can I start with you and then move to Dr. Bassett, and we'll let Professor Dinkins have the last word.
I think the only thing I want to emphasize is that when people say that there's no one living today who was a slave and there's no one living today who owns slaves, they truly bypass the period of legal segregation in the United States, which lasted for close to a century after slavery was over. And that's a period that was haunted by a high degree of white terrorist violence that I was talking about when I referred to the 100 massacres. And I would urge people to actually do a more intensive study of those massacres, particularly if they occurred in the community in which you live, because the ramifications have been harsh and tragic and vast. And I think that people are not aware generally that there has been that much violence that has been conducted against Black Americans in the United States.
Thank you for that. Dr. Bassett?
Well, I've been looking at these gaps in health and in life expectancy for a very long time. And it seems to me that I can end by echoing what Professor Darity has said, that we all need to read more history. You began this panel by talking about Juneteenth, which is now a federal holiday. It's in New York now a state holiday. And I think probably for many people, knowledge about Juneteenth sort of came out of the blue. And that would be true of lots of things, including someone like me who reads a lot. I hadn't heard about what happened in Wilmington, North Carolina, which in a way foreshadowed January 6th, until I read about it in the Darity's book. And sorry, I'm making it a Kirsten Mullen and Sandy Darity's book. So, the importance of history to understanding the current distribution of health is one that I can't overestimate and can't overemphasize. So that would be my parting suggestion, is that we all read more history. Some people seem to think that that's dangerous, and I think it's the way forward.
Amen. Thank you for that, Dr. Bassett. And Professor Dinkins, your final thoughts for the audience.
Yeah, thanks so much. This has been a pleasure. I agree. And the thing that I would think about is that that we're not always taking the defensive stance. Our recourse is often the defense. And the question for me becomes like the recognition that our fates and our well-being are intrinsically tied, whether we like it or not. And so taking steps towards things like reparations, while they might feel frightening to some communities and a promise to others, it's something that is for all of us that will allow us all to move forward better. And I hope we can imagine into that on all ends of the spectrum, right? So from many different perspectives, imagine what it might look like if your neighbor, if the person who is thriving, whether they live in a community that looks like yours or not, right? And think away from the fear of it, because we often waddle in the fear as opposed to imagining into proactive, generative, generous thought. And that's what I would hope people do.
Incredible. Thank you so much for that. I'm inspired. I feel so much more hopeful, honestly. Thank you. Thank you to the panelists. Thank you to Commissioner Vossen for opening this conversation up. Thank you to Dr. Julian Watkins, who shared an incredible grounding poem from Audre Lorde. Thank you, Professor Darity, Dr. Bassett, Professor Dinkins, for your incredible words and contributions to this field and to movements around social justice, and to all the work that might flow from this conversation, all the learning that might flow from this conversation. Thank you for setting the audience up to go deeper. We talked about everything from the Homestead Act and the colonial settler project to the trajectory of the civil rights movement over the past several decades. We talked about the fact that institutions, not just individuals, are really suffering from the racial wealth gap, right? And that minority serving institutions have less capital assets. We talked about what's possible and not only thinking about what can't be done, but thinking about what can be done when we avoid failures of imagination, which I would, of course, encourage all of us to stop doing. We also talked about, again, Afro-now-ism as an example of a willful practice for engaging and focusing on care instead of surveillance. And thank you again for sharing that, as well as this connection between modeling and expanding our imaginations. We really covered a lot. So thank you again to the panelists for allowing that to be possible, to the audience for tuning in, for all of your incredible questions, for the couple that we were able to explore, and for the many more questions that you all will answer based on your research going forward on this topic, where yes, we're giving you homework. So please continue to explore this topic and follow these three incredible panelists in their work, because it will certainly be a guide to you in these very, very difficult times. And in closing, I want to remind everyone just a few quick housekeeping things before we put on our closing video. I would love for everyone, of course, to follow the series for Reimagining Public Health in New York City. You can find it on our New York City Health Department YouTube page and our Facebook page. Stay tuned for more from the series after the summer. And I'd also love for people to know that there is a lot more coming based on your feedback. And so if you all would all consider filling out the post-event survey, you'll see the link to it on the screen in just a moment. We would love your feedback and love to hear from you about other topics you would like us to explore in this Reimagining Public Health for New York City series. And so I'm just going to introduce our closing video. It comes from the work of Professor Stephanie Dinkins, who was a panelist. This is a video excerpt from a project called #SayItOutLoud. Say It Aloud. This piece is currently installed at the Queens Museum, and it's available online as well at sayitaloud.stephaniedinkins.com. And this is an experience that asks you to explore questions through a central character, Professor Commander Justice. And this professor is speaking about Afro-now-ism, again, this willful practice that that imagines the world as one needs it to be to support successful engagement in the here and now. And it's really about reimagining our definitions of who and what we truly value. And it's really, I think, a video and a link that will be inspiring for all of you, a great way to close out this incredible 90-minute conversation. And thank you, Professor Dinkins, for sharing it. I think it's a great parting word for everyone tuning in today. So with that, we'll turn it over to the video. And again, look out for more from Reimagining Public Health for New York City in the coming months. Thank you again.
All right, my people. I've got a doozy of a message for you today. Are you ready for this? Liberation rests on the construction of a non-oppositional consciousness, unburdened by the need to continually challenge the fears, imaginative apprehension, oppression, and entanglements of others. The unencumbered, undistracted Black mind is a wellspring of possibility. It is a tool and a way of being that changes what valued experience in the 21st century is. Despite terrors cultivated in a nation built on slavery, and by excavating our joy, we are growing a pro-topian collective. Our strength is empowered by knowledge of mutually beneficial entanglements with past, present, and future, earth, sky, and microbes. The knowing work to animate these ideas. We mine, disassemble, and reimagine the world to our benefit, working toward fully empowered communities, personal selves, and others. We use our intellect, lived experiences, and the ability to commune across space and time as technologies propelling us towards intrinsic goals and fortifying outcomes. We harnessed what is and has always been ours. Often perceived as the spaces in between, beside, and beneath, we understand binary calculations are inadequate to assess us. We alone can nurture, fight for, and re-encode our mighty self. Remember, beloved, the spectacular technology of the unencumbered Black mind, combined with action, it's unstoppable.